Hello, this is Mrs. Politsky, and I have your responses for Chapter 13, the free response question. As we go along, you need to find your sheet and to write down the responses. Take a look at your question here. Matt is diagnosed with depression. Explain how each of the following terms is related to Matt's treatment. All right, so we have psychiatrist, the SSRI, the cognitive behavioral therapy, ECTs, and talk therapy. So, taking a look at letter A, a psychiatrist. Psychiatrists are medical doctors, they're MDs, who can prescribe medication for depression. In the case of Matt, depression has a biochemical component that would need a psychiatrist's care if medication is needed for this treatment. At the moment, we're not really sure what the severity of Matt's problem, but it is possible that he may be treated with some form of medication. SSRIs, what are these? Well, these are selective serotonin reuptake inhibitors. They are a class of drugs that is used to alter the balance of serotonin in the brain. And in the case of Matt, Prozac is an SSRI that may be prescribed because of a chemical imbalance of serotonin associated with depression. Letter C, the cognitive behavioral therapy. Okay, it is a form of psychotherapy that combines the techniques of the cognitive therapy with those of behavioral therapy. And in Matt's case, the therapist would try to get Matt to change his thought process and his behaviors, maybe getting away from negative talk or negative self-talk that might lead to self-defeating behaviors, and getting him to kind of change that voice so that it's a little bit more positive, and then to think about those behaviors and to improve upon those. Letter D, the ECTs. This is electroconvulsive therapy. It's a type of therapy primarily used for depression, and it also involves the application of an electric current to the head. It produces a generalized seizure. ECTs, for the most part, would be the option of last resort. Chances are medications would be used first. If nothing works, then this would be the route that a psychiatrist would probably take. Your final item, talk therapies. Okay, these are psychotherapies that focus on communicating and verbalizing emotions and motives to understand their problems. Matt would be advised to obtain talk therapy in conjunction with some of his biomedical therapy that he is receiving. Hope you were able to get everything written down, and if you need to go back, obviously you can do so. Thank you.